My name is Vivian Dagwa. This is Good Morning Kenya, and thank you for starting off your day with us. Now, we are going to be starting with a conversation that is on fit for purpose healthcare workforce. That is the topic we're having today. That is fit for purpose health workforce. And joining me for that conversation is Dr. Kelly Oluoch, who is the Chief Executive Officer, Kenya Medical Training College. Welcome to the show.
Thank you, Vivian.
You're well this morning?
I'm very good.
All right.
Yeah.
Let us start this conversation with you defining to us what exactly we mean by fit for purpose health workforce.
Thank you, Vivian. What we mean by fit for purpose health workforce is our graduates should be able to meet the expectations of employers and the expectations of the client. Here means a patient needing care must be able to receive the highest standard of care possible. In Kenya Medical Training College, we have invested in our processes to ensure that the kind of graduates we produce are able to continuously meet the expectation of various stakeholders. And we do that currently. We are not only producing human resources for local consumption, but are also producing human resources to export to other countries. And to us, fit for purpose means, in this case, being able to satisfy the demands of these countries. For example, if a health worker is going to be performing their function in France, for example, they should be able to speak French. Kenya Medical Training College has invested in a language, in teaching a language like French. If the health worker is going to work in German, they should be able to speak German language. And that means that we should be able to invest in training our students at final level to be able to speak German. We are actually working on the same. We have also some other languages like Arabic. For those who want to work in UAE, or Arab-speaking countries. Right now, we have started developing a curriculum in Amharic for those who may want to work in Ethiopia. And we continuously look at where are our workers going to be and what do we need to do to prepare them for such a workforce. In the local workforce, what we do to make sure we are fit for purpose is, for example, now we have rolled out SHA. We need to make sure that the processes are efficient and effective. So we have worked with stakeholders to begin a course in medical health insurance. This is supposed to support the government in ensuring efficient rollout of SHA, to make sure that registration takes place appropriately and as quickly as possible, to make sure that pre-authorizations are properly done, to make sure that processes of claims management are properly done, and to ensure that the whole value chain in ensuring we have a proper working universal health coverage is done. So for us, fit for purpose here means we must be able to support the government agenda in ensuring that the government initiatives are properly conducted through human resources for health that we produce.
All right, now we get the whole understanding of fit for purpose, a fit for purpose health workforce. You talked about exports, you know, you train your students in the sense that they are open, they can be fit, you know, even when they go to work in other countries. But I want to ask the question of, if we look at the ratio of patient and the doctor to patient, or just medical health worker to patients, I feel like we are not yet where we are supposed to be. So when you talk about matters exporting, do you feel like it's a threat to us as a country, you know, matters healthcare?
It is not a threat to our current situation in healthcare in Kenya. The reason is this: Kenya Medical Training College, in the recent graduation, graduated a total of 21,261 graduates. In the last year, the year preceding this graduation, we graduated 22,965. So it means that the institution is producing sufficient number of mid-level human resources for health. Actually, the institution produces over 85% of mid-level human resources for health for the country. We also note that not all of them are absorbed in our counties or private sector. And therefore, the surplus is what we prepare to be able to support other countries who are also struggling with human resource for health. Again, this is good for the country in that we are able to earn foreign exchange. Number two, when these health workers come back to our country after the period of service in other countries, they bring in new knowledge, what we would term brain gain. So that improves the way in which we operate our current local healthcare. And therefore, it has double benefit for the country, but also it supports the government agenda of youth empowerment, ensuring that the youths have jobs. So we are able to support the local health workforce and be able to also support countries that need human resources for health.
Yeah. So from where you sit, it's not really a brain drain, it's a brain gain.
Brain gain, yes.
Yeah.
Yes.
Okay. So how does a fit, a proper fit for purpose health workforce for us as a country enhance the overall healthcare quality?
Thank you. What we do in ensuring we have a proper functioning healthcare system is to ensure that we have the appropriate skill sets in the healthcare sector. And that means that we should be able to produce sufficient human resources for health for all continuum of care. For example, preventive, promotive, rehabilitative, curative services. So Kenya Medical Training College has 99 courses that are organized in 18 departments and 7 faculties. We're able to produce human resources that fit all these areas that are expected in a properly working healthcare sector. And therefore, another issue that we do at Kenya Medical Training College is consistent quality checks. Kenya Medical Training College courses are regulated by over 10 regulatory bodies. Additionally, Kenya Medical Training College is a ISO certified organization, and we are also our courses are certified by Kenya National Qualifications Authority. This assures the public and all other stakeholders that we are producing fit-for-purpose human resources for health that are competent to work in various sectors in our economy.
As it is at the moment, maybe what specific skills would you say are lacking currently, in the health workforce in the country that ensures that we get to meet all the needs that are needed to be met when we talk matters healthcare? What skills are lacking that should be improved on?
The Ministry of Health has just concluded in around 4 months ago health labor workforce analysis report. And it shows the ratios that we need in terms of patient to health worker ratios. Again, in this report, we also see the feedback from various stakeholders. And what is there is that most stakeholders want our workers to be able to have more of soft skills that enable them to communicate better with the patient. Another issue that we must enhance is digital capacity of our health workforce. And so Kenya Medical Training College, in an endeavor to improve on this, has improved on its curricula. And at the same time, we have entrenched ICT within all our processes, including student learning processes. That includes an ERP, an enterprise resource planning platform. We also now have an e-learning platform, an e-library that enable our students to be able to interact with technology and be able to work in a continuously evolving healthcare environment.
Right, so right now we know that there was the rolling out of SHA, you know, so it is what is is working right now in the country. You know, there's no more NHIF, so now we're we're using the SHA, right? So probably what are you doing specifically as KMTC in ensuring that you are equipping them? You know, you're equipping the students on matters to do with this as they come to the workforce now.
KMTC, being an institution under the Ministry of Health, has a responsibility to ensure the success of SHA rollout. We as an institution work alongside other institutions and the ministry to ensure rollout in various counties. For example, KMTC is rolling out with various counties in two counties actually right now. And number two, we help in giving public information concerning the information frequently asked questions about SHA. We also, because of our presence in 45 of our 47 counties, and because every single day Kenya Medical Training College students are attached to over 450 health facilities across the country, we are able to support in the rollout, registration, giving public information, and supporting counties to roll out SHA within their various jurisdictions. Yeah,
so you're actively involved in that as well.
In addition to that, we have instituted a new course, that is medical health insurance course, to support in registration, pre-authorization, claims management, and efficiency and effectiveness in the SHA rollout. Yes.
All right. Also, do we incorporate, you know, patient feedback when it comes to us to be able to also continually just to improve, you know, in the fit for purpose as it is right now, you know, not just from KMTC, just generally if we look at our healthcare systems? Do you feel like we allow that, or we create room whereby there's patient feedback in order for us to just ensure that we are doing the right thing as a healthcare system?
Yes, there's a lot of incorporation of patient feedback, and not only patient feedback, but all stakeholders. The way in which Kenya Medical Training College develops its curricula is through what we would call a Delphi approach, where stakeholder engagement is key in developing and reviewing curricula. And Kenya Medical Training College basically reviews its curricula every 3 years to make sure that they're current in terms of what are the expectations of the health worker, what are our consumers saying about the product we have in the health market, in the labor market. And as a result of this, gaps like communication skills, gaps like integration of technology are consistently being added into our curricula. Gaps like being able to speak languages that initially were not part of what we train at Kenya Medical Training College is now being incorporated to ensure that we consistently evolve to meet ever-changing customer or client expectations. Yes.
And how maybe can we make it better? How well can we make the patient feedback better in order for us to have that?
Is basically to be continuously a listening organization. Being able to put patients first. Being able to ensure that we do not imagine what the patient wants, but actually engage the patient in feedback process, so that it is real-time feedback which is collated and organized in such a way that it can be material used to be able to change curricula to support what the patient needs. And not only that, because the technology in healthcare consistently changes, it is also not only just good enough to incorporate patient feedback, but it's always good to look out for various changes in practice, changes in technology that work best for ensuring that the patient is taken care of. So all this needs a 360-degree kind of engagement with all stakeholders, not only patients, employers, with innovation companies, with technological companies, to ensure that all that is incorporated to make curricula better for ensuring that the kind of products we have meet expectation of various stakeholders.
Yeah, and maybe just to still stay on the same, what other strategies do you feel can be implemented for us to improve our healthcare workforce?
The government right now is approaching healthcare in what is called the one government approach, meaning that all sectors should be working seamlessly to ensure that healthcare provision is effective. Health is a very multifaceted kind of sector that does not only focus on one part of patient well-being. There are so many things that affect healthcare. For example, agriculture has a way of affecting healthcare because of food adequacy and food security. So the approach that the government is right now putting in place is to make sure that all sectors are linking to ensure that we have a seamless approach in terms of ensuring that health as it is guaranteed in a safe, quality environment. Yes.
Yeah. How are we preparing our workforce to utilize new technologies? As you've said, it keeps changing. Even in the, not just in the healthcare system, but generally, technology keeps upgrading and changing every other day. So maybe how are you preparing, how are we preparing our workforce to be ready for that? You know, to be ever changing with the changing of the new technologies.
As leaders in health care training, KMTC has to show the way, walk the way and show the way, and be able to ensure that we're able to support our students. Right from registration of students and application, everything is digitalized. We work with KUPS, Kenya University's Central Placement Services, to ensure that admission or placement of students and selection is done digitally. When they report, they register on a digital platform that is an ERP. They also enroll on e-learning platform. They access digital materials in the library through an e-library. We provide seamless access to internet in our campuses. Our students do their continuous assessments online. And so right from the processes, students get to incorporate digital literacy in their day-to-day learning processes. The other way in which we embrace technology is industry academia collaborations. We have companies that work close to us, especially in medical engineering and medical imaging sciences and physiotherapy and occupational therapy, which wherever there is a new technology in the environment, our students get attached. We organize webinars, and we consistently have interaction between professionals who are working in continuously evolving fields with our ongoing students. And our students are attached to these industries, and they consistently learn what needs to be done in an environment where they're going to work. And so with that industry academia collaboration, we've been able to keep up with ever evolving technologies.
All right. And probably maybe for someone who's watching right now and they would love to get into the medical, field, get into that workforce, that is what they're looking at. Where would you say is the best place to be in terms of them picking the courses to do right now? Speaking from someone who knows the industry, knows the field, knows where the gaps are, which are the best courses to take right now?
Thank you. Kenya Medical Training College has 99 courses, and Kenya Medical Training College has 97 years of experience in training middle-level human resources for health. This is the best place to be. The reason is we provide over 85% of human resources for health who work both in private and public sector. Kenya Medical Training College was recently awarded as the best tertiary institution in just concluded awards for ICS. And again, Kenya Medical Training College, because of various quality checks, including ISO certification, registration and recognition of its certificates by Kenya National Qualifications Authority, and the presence of Kenya Medical Training College in 45 of the 47 counties makes it the best destination for a student who wants to pursue a medical course. Again, our graduates are well sought after, not only locally for various counties, but also internationally. This year alone, we have processed for export over 3,000 graduates to work in various countries. And this continues to rise, and we continue to get a lot of support from various stakeholders to make sure that our training meets stakeholder expectations.
All right. And on that note, we do take a break. Don't go too far. When we come back, we will continue with this conversation, which is Fit for Purpose Health Workforce. Don't go too far. Welcome back, and thank you for staying with us. With me is Dr. Kelly Oluoch, the Chief Executive Officer, Kenya Medical Training College. Our conversation is on Fit for Purpose Health Workforce. Now, Doc, how are we able to enhance, our trainings, in different institutions, the training programs to be ready and very effective in terms of, or in the sense of addressing emerging healthcare challenges? For example, we had COVID. How prepared are our students, who soon will be our health care workforce, ready for such emergencies where we were not foreseeing it, it just came?
Thank you. The healthcare training needs to be extremely flexible and be able to open up to evolving changes in the environment. And in healthcare training, what we do is to ensure that we are consistently on the lookout for changes and demands in the environment where health workers are going to be. Looking back at the COVID-19, it really taught the organization so much. Number one is that we must be consistently looking at the changes in the environment. And number two, we must be ready for disasters. And number three, that our curricula must consistently be adaptive to the environment. So as Kenya Medical Training College, we recognize that our widespread presence in in our counties with 87 campuses is very key in terms of managing calamities, managing emergencies, and managing very rapid changes in the health environment. For example, we note that one of the biggest challenges that the country grapples with is managing accidents and emergencies of that nature.
Yeah.
We recently, under corporate social responsibility, have embarked on training bystanders to support accident situations in the country. And here we have actually trained over 1,400 border riders on resuscitation, first aid, and being able to respond to emergencies that exist on our roads and at our home states. So Kenya Medical Training College is not only just focusing on long-term training, but also focusing on key skills that promote health and prevent loss of life that could otherwise be saved if someone knew something about what to do in an emergency scenario.
Yeah.
So KMTC is highly adaptive in the way it approaches training and the way it supports communities to be able to respond to emergencies, including accidents.
Yeah.
Thank you.
And I feel like that's really important. You know, I feel like every single person should have this first aid skills. Don't you agree with me? Maybe more should be done in that area whereby most people are equipped with at least that. You know how to resuscitate someone. You know what to do when someone maybe is having a stroke, like the immediate first aid. I think we can do more on that.
We are doing it. What we want to do is to make sure that we are able to train over 9,000 bystanders to be fast responders in cases of emergencies.
Yeah.
But not only that, households need to be ready to respond and save lives, and as they wait for skilled response from health workers.
Exactly.
We frequently encounter chokes in our households.
Yeah.
We frequently encounter suffocations. We frequently encounter drowning. We frequently encounter accidents, including cuts, and these are things that can easily be managed by a bystander at home as you wait for response from a qualified health worker. So no one needs to lose life, which can be prevented if someone else has a skill. And Kenya Medical Training College recognizes this, and that is why we as Kenya Medical Training College have embarked on ensuring that the communities around us are knowledgeable on what to do in cases of emergencies and where 1 minute means life or death of a patient, and what these bystanders can do to be able to rescue a dire situation.
Yeah.
Thank you.
All right. Now, what is the role of KMTC when it comes to the universal healthcare coverage?
KMTC plays a very big role in universal health coverage because it is the largest trainer of human resources for health. As I mentioned, we train over 85% of human resources for health. Currently, we have a student population of over 66,000. That means that in our training, we will be contributing in a large way to the key pillar for health, and that is human resources for health. By the very sheer number that we graduate every single year, that is over 20,000 graduates, then we ensure that there is adequacy in the human resources for health that is needed for universal health coverage. Further, Kenya Medical Training College is present in 45 of our 47 counties with 87 campuses. This ensures that in every single day, students are attached to over 450 health facilities across the country every single day, and that supports provision of healthcare under skilled supervision. The other issue is the support we give to communities around us in terms of medical camps, in terms of trainings for basic life support skills, in terms of donation of blood, in terms of other community-facing services that support in universal health coverage. We have also, as we have discussed earlier, supported the rollout of SHA. We have supported in coming up with a training in medical insurance. Then that supports efficiency and effectiveness of the mandate of SHA. And every single day, Kenya Medical Training College supports communities through what we call rural attachment of our students to support immunization, promotion of sanitation, and making sure that communities are aware of health choices that they make on a single day. We also train sufficient human resources for health to support primary health care, basically at households through community health assistance, making sure we have nutritionists at household levels, making sure we have public health officers, making sure we have community health workers across the country. Yes.
Okay. As we almost come to a conclusion of this conversation, maybe what strategies can be implemented to improve the retention rates among the healthcare professionals? I know you've mentioned that you get to graduate over 20,000 graduates every year from your institution, and that we have enough, right? Like, we have probably maybe enough healthcare workers in the country, but if we look at the ratio that we talked about of patient to healthcare worker, we're still not yet there. You know, we've not gotten to the required ratio rate. So maybe what more can be done to just ensure that we retain our health workforce? Because as it is right now, I feel like almost all my friends who are in the medical field are not in the country. They leave the country. But we don't have enough health workforce in the country. So maybe what more can be done in order for us to also get to retain? As much as we export, we also get to retain professionals.
There's a lot that needs to be done. Training is only one aspect of ensuring we have proper supply of human resources for health. Counties are supposed to also play a role in their employment. So training is one bit, but employment is another bit.
Yes.
So you may train so much, but counties also need to allocate resources for adequate absorption of human resources for health. We mean here that there should be sufficient budget by counties and deliberate effort by counties to employ human resources for health. Again, there's a tendency for most counties to employ only on the curative facets of human resources for health, leaving out very major areas like rehabilitation, like promotion of healthcare, which are very key in saving resources that eventually are then being used on curative services. So there needs to be a balance in employment to ensure that you look at all the continuum, right from rehabilitation, promotion, curative services, and other diagnostic services. So what needs to be done is a healthy mix of employment to ensure that every aspect of health is taken care of. Number two, the work environment for health workers serve to either retain them or make them leave. So the work environment here is there should be sufficient supply of equipment, sufficient supply of health products that are needed for a health worker to make decisions concerning a patient. In here we mean that drugs should be available in health facilities. There should be capacity to ensure diagnosis is accurate by ensuring that equipment are in place, and we need to have sufficient capacity to make interventions in case, let's say, a diagnosis has been made. We need to have capacity in our health facilities to make sure that the patient is taken care of until they are discharged from the hospital. So essentially, the bit of the hygiene elements of service delivery needs to be taken care of. And more so, we also need to be listening to most of the demands of the health worker to make sure that they are properly retained in our workplaces.
Okay, my final question. What health workforce challenges do you feel you're facing right now, and how can we curb it?
The health workforce challenges that we are facing as a country right now is basically on the employment of qualified human resources for health. In as much as we are training sufficient numbers, we need to make sure that as many as possible get employed so that we do not have cases of burnout of health workers. You have realized of late that most health workers complain that they work for too long. So if we are able to employ sufficient numbers, then it can support us to ensure that health workers work in environments where they do not overstretch themselves. We also need to ensure that we have conversations that continuously improve on the skill sets of health workers. For example, there should be sufficient provision for health workers to develop in their skills and specialize, and therefore enable them to grow and have hope that they will eventually rise in their careers. So there should be a proper arrangement for training that enables those who are already in service to be able to rise in terms of their skills, be able to provide specialized training for our doctors, for example, so that when they go back to the environments where they work, then they are properly prepared to face emerging challenges. The other issue is counties working together, because counties will not have homogeneous skill sets of health workers. So a county A may not have a surgeon, a general surgeon. County B may have a general surgeon. How do we transit services between counties? How do we make sure that counties are talking to each other and that they're able to manage those disparities that exist among them, and also share the burden of costs of healthcare? And if this is done seamlessly, then it will be able to sustain the kind of vision that the bottom-up economic transformation agenda is trying to achieve.
All right, I'll allow you to give us your final remarks as we close off.
Thank you for hosting me. Kenya Medical Training College is an institution that provides 85% of human resources for health in the country. We admit students in March and in September. Be on the lookout for opportunities to be admitted at Kenya Medical Training College. We collaborate with COOPs for this admission to take place, and we would want to ensure that those who are going to get the results for Form 4 should be able to make time to visit our website www.kmtc.ac.ke to be able to get information about how they can apply for courses at Kenya Medical Training College. Again, we also want to wish the country a Merry Christmas and a Happy New Year as we get into this festivity season. Ensure that as you travel, you maintain proper road ethics to avoid unnecessary accidents on the road. Thank you.
Absolutely, and I'm sure you're the first one to wish them a Merry Christmas on this set. Yeah, and that was Dr. Kelly Oluoch, and as he's mentioned, he's talked about us ensuring that we are safe on the roads, and he is just in line because our next conversation is on road safety measurements, especially during this season, which is the festive season. Mike Migwe is coming up next with that conversation. Don't go too far.